Fevers in babies and children can be terrifying for their parents, but it's important to note that fevers serve a purpose and it's the body's natural way of expelling viruses and pathogens. So it's important to work with a fever and not fight against it. I'm going to share some tips with you to help your babies get over fevers fast and naturally. First, it's important to keep your child hydrated and warm. If your baby is still breastfeeding, keep breastfeeding as much as possible and offer water if necessary to children who are not breastfeeding. Keep the baby hydrated. The next thing is warmth. Kangaroo care is the best way to monitor your baby's temperature, and especially for kids under 2 years old. The mother's body has the ability to regulate the baby's temperature, heartbeat, and breathing. So the best place for any baby to be under the age of 2 years old is on mom's chest, preferably skin to skin, kangaroo care with a light blanket over both of you. Don't worry if the baby starts sweating. This is the point of the fever. You want the baby to sweat to expel the pathogens. Again, make sure to offer fluids frequently, offering breast milk, formula, water, tea, and electrolyte-rich drinks as frequently as possible. Don't worry if your child doesn't have an appetite. The rule is to starve a fever. Just keep offering hydration and warmth. I never recommend using paracetamol, ibuprofen, or cold baths. Paracetamol depletes the body's glutathione levels, and glutathione is essential for expelling pathogens, so it's counterproductive. Putting a baby in a cold bath puts your child at risk of febrile convulsions. You actually need to keep the temperature up. If you drop the core body temperature too rapidly, the body is going to then scramble to get the temperature back up, and this is where you risk febrile convulsions. Ibuprofen is the leading cause of aseptic drug-induced meningitis, so please don't give your babies ibuprofen when they have fevers, and avoid rushing off to the hospital. Putting a baby in a car seat when it has a fever can cause the baby to overheat. So if you can treat the fever at home naturally, that would be optimal. I also recommend giving babies hourly doses of liposomal vitamin C to power up white blood cells, and liposomal MSM to help manage pain and fever.